Well, Sam, Sherry, Stacy, Tori, Camille, Carol, Deborah Blackman, Parrish. Welcome, welcome, welcome to the webinar. We'll get started in about 4 minutes. We're waiting for all of our panelists to join. We are so excited. Welcome, Cora. Welcome, welcome to the webinar.
Yeah, that's the newest one, right?
Welcome, Melissa Boston.
Look at me, Dr. Rita.
Hey,
I can lift my arm up.
I'm so happy. Yeah.
I got 2 arms up. Yay.
Congratulations.
Thank you.
Welcome, Dr. Crawford. So glad. Welcome, welcome to the webinar. I'm looking for my medical advisory team. They are slowly hopping on here and looking for my guest speaker.
Make sure he's not on the attendee side.
Yeah, I don't see him on the attendee side. Let's message him. Ah, there's Dr. Rosado.
I've been here for 10 minutes.
How are you?
I am well.
Very good. We're going to get started in about a minute here. We're giving folks a moment to hop on the line. We want to welcome everyone. Welcome, welcome, welcome. Put in the chat if you are a guest and who you're a guest of. You can just type it right there in that chat. We want to welcome our guests. And then we also want to know how you're feeling. So we want to find out if you're feeling awesome, awesome, or awesome.
And if there's anyone from Louisiana, lots of prayers.
Oh, yes. Hurricane is really. What's the weather like in Florida?
Hot.
Yeah.
Hot and muggy. Today, it read 96, but with the heat index, it was 106.
Wow. Wow. Well, it is 8 o'clock and we're going to get started. I just want to welcome everyone. I'm very excited. You know where I am on Wednesday. Every Wednesday, I'm on call at the hospital, helping those moms push those beautiful blessings out. But we want to welcome first our medical advisory board here at Wakana. So I want our advisory board, if your video is not on, can you put your video on so everyone can see you? I first want to introduce LaShawn. LaShawn, you want to wave there, Nurse LaShawn? She's
Hi,
one of
everyone.
she's one of our RNs who also is very involved and engaged with the Lupus Foundation. She is a lupus patient and has had just incredible results with our products. So I want to introduce LaShawn. Then we're going to go over to Dr. Tyus Crawford. Dr. Crawford is a family practitioner here in Chicago, also on our medical advisory board, as well as Dr. Joyce Smith. You want to wave to them. Dr. Joyce Smith is our PharmD, who is, I think, just driving home from work, but we wanted you to see all of the faces. And I think I saw Dr. Herman Glass. Maybe Dr. Herman Glass is on the attendee side, but I thought I saw his name.
If I see him, I'll change him.
Thank you so much, Kathy. He's a chiropractor out of Detroit, Michigan. And then, of course, Dr. Charlotte Mitchell is our internal medicine. There's Dr. Herman Glass. There's Dr. Herman Glass. Thank you so much for joining as a panelist. Dr. Charlotte Mitchell, our internal medicine doc. I think she is on call, as well as Dr. Napasha Gettings, our child and adult psychiatrist. And we also have Dr. Erica Montgomery. She's a clinical psychologist. She is at work as well. But I just wanted to introduce to you our Wakana Medical Advisory Board. So thank you so much. Stay tuned, panelists, for questions as well as our attendees. So I'm Dr. Rita McGuire. I'm the Chief Medical Officer here at Wakana. I'm one of the co-founders as well. And I have a special guest this evening. And I am going to do this, show them your picture as I properly introduce you to our attendees. So Dr. Joseph Rosado, after, let's see here, we'll do that. After spending several years in Central Florida, he was working as an orderly, then an EMT paramedic and heart cath lab technician. Dr. Rosado realized his passion for the medical profession. He started chiropractic school, Dr. Herman Glass. You have that in common, at Life College in Marietta, Georgia, where he graduated cum laude with a BS degree in clinical nutrition and a doctor of chiropractic degree. After practicing for several years, he went on to the university in Dominican Republic, where in 2001 he graduated summa cum laude with his medical degree. In 2005, he completed his MBA in healthcare management from the University of Phoenix and graduated magna cum laude. In 2018, he became a diplomat of the American Academy of Cannabinoid Medicine. Presently, Dr. Rosado is the co-owner of Costal Cannabis Clinics, a group of medical cannabis clinics in
Volusia County. Volusia County, that's northeast central Florida.
He's also the president and CEO of International Medical Consultants and co-medical director for Minorities for Medical Marijuana. And that's where I met Dr. Rosado, as well as I am also active in that amazing group, Minorities for Medical Marijuana. He's also the medical director for marijuanadoctors.com, and he's also on the scientific board of advisors for medical extractions in Quebec, Canada. Wow.
And Colombia.
And Colombia. As an advocate, he was and is on the Bureau of Speakers for political campaigns and medical cannabis dispensaries licensed producers. I want to welcome you tonight, Dr. Joseph Rosado. He is my colleague. He is a dear friend of mine. We are excited to do some amazing work in the very near future. I know our work has kind of been delayed because of COVID, but we are going to be doing some amazing work with research and observational studies, etc. So tonight, what we're going to do something really fun, and we're going to first just find out from Dr. Rosado how he really got into the space of cannabis. We're going to then talk about the difference between CBD and medical marijuana. And then we're going to move on to questions. Tonight, both Dr. Rosado and I are going to be answering questions, not only from the medical advisory team, but also our attendees, those burning questions. A disclaimer, we cannot make any claims that CBD can cure, treat, mitigate, diagnose any conditions. This information that we're going to be giving you is one based on anecdotal studies as well as our experience in the field. But at no way are any of these statements approved by the FDA. I will be really repeating that disclaimer a lot this evening. So Dr. Rosado, welcome. And you can take it away with first, just how did you get in the industry? Especially an industry where we don't see many minorities.
Well, the minorities that you see in the industry are in prison or in jail, unfortunately.
Unfortunately, yes.
And having been a jail and prison physician, I saw way too many in prison for a dime bag or a nickel bag. So it's an atrocity. And for that, we support the Last Prisoners Project that Minorities for Medical Marijuana has been advocating and helping people either getting out of prison or working on expunging prison records, etc. Anyway, I am the atypical doctor in that while in medical school, in pharmacology, I did learn about the endocannabinoid system. Now, there's less than 10% of the medical schools in the United States that even address the endocannabinoid system. I was fortunate being a foreign medical graduate that we did discuss it. Now, granted, it was a paragraph, and immediately thereafter, they went into, the toxicity and the devil's weed and how bad it was and how addictive it was, et cetera, et cetera. And being that I'm called in Spanish un cucarachero, meaning someone that likes to go into the details and learn more, go beyond what I learned in class, I went to home and I got my Goodman and Gilman out, which those of you that went to medical school know that that's the pharmacology Bible. It's like this thick. And I went to cannabis and I learned all about further, the endocannabinoid system, the cannabinoid receptors. And I learned that cannabis is not physiologically dependent, or it's more psychologically dependent, meaning that it's virtually impossible to become physically dependent, contrary to cocaine or opiates, etc., where you need a higher dose to acquire the same response. Whether you smoke one joint or 20, the effect is still the same because you're saturating those receptors in your body. And so I learned that this was going to be another tool in my toolbox. But unfortunately, it wasn't legal then. It's still not legal in the Dominican Republic. I took my boards, started practicing, etc. In 2010, one of my best friends called me from Arizona and said, we have medical cannabis in Arizona, and I need a medical director because every dispensary has to have a medical director. So I said, sure, let's look into it. So decided to look at the possibility of transferring my license, getting my license in Arizona, and his wife, who they have a child that's a week older than my twin daughters. And so at that time, our three kids were adolescents, and she didn't feel comfortable us getting involved in medical cannabis because we're teaching kids to abstain from drugs, but yet we are promoting medical cannabis. And so I called her up. I'm like, Jan, this isn't Joe and Don selling weed on the corner. We're doctors Rosado and Dirk. And she's like, no, I don't feel comfortable. So that project was tabled. And I had to wait 4 years until Florida then got into the act. In 2014, one of our local attorneys who was funding the decriminalization act that was going to go before the election in November of 2014, I sent them an email and said, I'm a physician, I'm an advocate, how do I get involved? And within a week, I was part of the Bureau of Speakers, and being that I'm bilingual and bicultural, I immediately started going to the Spanish radio stations, Spanish TV stations, English TV stations, radio stations, newspapers, etc. And of course, 2014, we didn't, the law didn't pass. So we had to wait until 2016 for the amendment to go back to the drawing board and be voted on, which in 2016 it did pass. However, so I continued advocating. I couldn't recommend, I couldn't prescribe anything because we had no laws, and we had laws, but we had no product, no medication. So in 2016, when we actually had product, 4 years ago this month, I was the first in the greater Central Florida area to recommend medical cannabis to a 35-year-old female who at that time had a stage 3 astrocytoma, a brain tumor in her frontal lobe. When she came to me, she had partial lobectomy. They had removed a portion of her frontal lobe, and a portion of the tumor was still in her brain that they couldn't operate, and they couldn't do any chemo radiation. And so her neuro-oncologist was telling her, you're just going to have to wait and see. Well, she didn't buy that, and so she came into the office, and at that time, the state of Florida had a 90-day rule, which meant that we had to establish a doctor-patient relationship for 90 days before I could recommend any cannabis to her. So we went through that process. She got her medication. She was the first to get in the greater Central Florida area. She was fine in remission until 2 weeks ago. And of late, she was a yoga teacher teaching yoga on the beach. But unfortunately, last week, I received a message from her that they discovered in one of her sequential MRIs that the tumor is now in the area of her cerebellum, which is the back portion of her brain, and it's considered inoperable, and they're doing additional testing and to see where she's going to go from here, which is sad. And then in November of 2016, I was the first in the state of Florida to recommend medical cannabis to a pediatric patient, a 15-year-old that had a very aggressive stage 4 rhabdomyosarcoma, head and neck tumor that had eaten out his jaw, his cheek, his eye socket, his eye, a portion of his skull, and it had penetrated into his brain. And when we started, he was on 16 milligrams of morphine by way of a morphine pump every hour. And within 2 weeks, we got him down to 8 milligrams of morphine. We were able to cut the dose by 50%, which allowed him to enjoy his family. He was no longer in his hospital bed in his room. He was able to participate with his family in the living room, was able to eat in the kitchen, was the best man at his brother's wedding. And although he passed in February of the following year, those last few months, his quality of life improved tremendously. And what was interesting and touching at the same time was, he's of Puerto Rican descent, a Hispanic, and the family went through all kinds of crap from their other family, their extended family. Why are you giving him marijuana? Why are you giving him weed? What's wrong with you? And so to deal with that stigma and deal with that controversy was quite challenging. But mom, stepdad, dad, his stepmom was my medical assistant, so I had a little leverage because he had already seen me working with some patients. So it's like, I don't care what you people say. I've seen what he does. I know what he's capable of doing, and I trust him with my life, and I'm going to trust him with my stepson's life. So that was a huge advantage. And so from that point forward, once the media saw me and the TV station saw me, my practice boomed. And parents were driving from South Florida, from Miami, which is a 4.5-hour drive to where I am, to have me see, manage, and evaluate their children. And so the specialty that I liked the least, and when I was chief resident, I rotated through, I scheduled myself to rotate through pediatrics in the month of February. Anyone know why I chose February to rotate through pediatrics? Because it's the shortest month of the year. So I hated pediatrics. Not so much the kids, because I love the kids. It was having to deal with the parents. So for that reason, I scheduled myself for the least amount of time in pediatrics. And once I started doing medical cannabis, my practice was primarily a pediatric practice. Children with Dravet, Lennox-Gastaut, cancer. My youngest patient was 18 months old. And so from that, I got a lot of support and feedback from the parents and moms and dads. And so one of the groups that I lecture for free is Cannabis, which are parents of children that are on cannabis. And so I dedicate my time for them at no cost. And then a percentage of the proceeds for the book that I published last year goes to Cannabis.
Wow, wow. What a great journey, that you've gone through and looked at the stigma that has been very close to home. And we talk about the negative stigma, and that's a part of our mission and our vision is to end the negative stigma here at Wakana. And we really impact communities by educating and empowering. So let's move on to one thing that we want to get clear, and that is the different strains of cannabis. We know that cannabis, has a marijuana and a hemp, and we want to really help those who are guests to understand the difference because our products are sourced from hemp. So what is the difference between marijuana and hemp?
May I have permission to share my screen?
Yes.
This is one of the slides that I use. Oh, crap. It's one of the slides I use in the lectures that I give. One of the many lectures that I give, because it's very confusing to, what the differences are between the CBD from hemp versus CBD from cannabis versus CBD and THC. So in the plant world, there are no strains. So that's a misnomer. A lot of people talk about strains. Strains are in bacteria and in viruses, okay? Plants do not have strains. Plants have a family, a genus, a species, a subspecies, okay? So when you talk about strain, you're talking about viruses and bacteria. When you're talking about plants, you're talking about what we talked about, the genus, the family, the species, the subspecies. And then when you talk about the different subspecies, there you're talking about what are called chemovars, okay? Which is a different specific characteristic of each one of the plants. So the easiest way I present this is the mother plant, Cannabis sativa L, is the actual mother. And I've seen on your website that when in the description of your products, you always talk about it comes from Cannabis sativa. That is accurate. That is truly accurate. And I commend you for that because the mother plant is Cannabis sativa L. Now, Cannabis sativa had a set of twins, a boy twin and a girl twin. The boy is hemp. Hemp is long and lean, okay? Whereas cannabis, the female is short and thick, not fat, because girls are not fat, they're thick.
Not that.
They're thick, nice and thick. I'm getting a lot of applause on that one. So cannabis was originally the correct name. Marijuana is a derogatory racist term that was implemented in the 1930s by Harry Anslinger, which, for those of you that want to learn and read more on that, it's found in my book, Hope and Healing, The Case for Cannabis. And the foreword was written by Professor Lumir Hanoush. Professor Lumir Hanoush was the gentleman that when Raphael Mechoulam discovered the first endocannabinoid in 1992, he named it. And he named it anandamide, which comes from the Sanskrit word ananda, which means bliss. So it is the blissful endocannabinoid. Now, I said 1992, so that tells you how young this science is. That's when I graduated chiropractic school in 1992. So I was a young baby of 30 at that time. I just turned 58. So I'm 2 years away from the 6-0.
We're the same age.
So understand that hemp, being the male plant, has been used in the past for textiles, for clothing, for ropes. Back in the turn of the century, back during the forefathers, they grew hemp. They used hemp to pay taxes. They used it for monetary purposes, for money, but also it is very high in CBD and very low in THC. Now, the idea of the 0.3% definition, that is not a botanical definition, that is a political definition. In the United States, for it to be considered legal and for it to fall under the Farm Bill 2018 that was signed into law in December 2018, the law reads that if it's less than 0.3% THC, it is hemp and it is legal. Anything greater than 0.3% THC is considered cannabis. That's political. That's not botanical. That's not the plant. The plant shows that hemp is primarily CBD with a little bit of THC, and cannabis is primarily THC with some CBD. And from the cannabis plant, you can get multiple chemobars. Cannabis had multiple children, and that's where you get the hybrid, the sativas, the indicas, the CBD, etc. Those are the chemobars. But research has now showed us that that concept of sativa, indica, and hybrid is really a misnomer. And the latest terminology, which Ethan Rousseau used, Dr. Rousseau uses, which he spoke about a month ago.
Ethan Russo, yes.
Yeah, he's using this terminology as well as Dustin Sulak, where they're using category type 1, type 2, type 3. Type 1 is high THC, type 2 is a 1-to-1 CBD or the blends, the CBD THC ratios, whether it's a 1-to-1, a 4-to-1, a 1-to-5, etc. And then type 3 are your CBD or predominantly CBD products. Now, the key to everything is the fact that you want to use the whole plant. You want to be full spectrum, which again, something that kudos to you guys, to your product line, that everything is full spectrum. Now, are there times where individuals need a broad spectrum? And for those of you that don't know the difference, I'm going to run through them really quickly. A full spectrum contains all of the phytocannabinoids. Phyto means plant, cannabinoid means that works on the cannabinoid receptors. So phytocannabinoids. It has all of the phytocannabinoids. So you have CBD, CBG, CBN, CBC, THC, etc. You have them all in one, like an orchestra working together. That's a full spectrum. A broad spectrum is exactly the same thing as a full spectrum, just no THC. So it has all of the phytocannabinoids, but no THC. This is important for individuals that are drug tested, that undergo urine drug screens. And if even though it's 0.3% or less, THC is stored, once it's absorbed in the body, it's stored in the fat cells and then released periodically as the weeks go by, which is why you could smoke a joint today and a month from now test positive on a urine drug screen because it stays that long in your system. Whereas the last portion are the isolates, and isolate is just that. They isolate a specific phytocannabinoid. So a CBD isolate is just CBD, nothing else. A CBG isolate is just CBG, nothing else. I'm a big proponent of using the whole plant, full spectrum or broad spectrum on those individuals that have to be urine drug screen, like my police officers or EMS personnel or nurses or school teachers that work for certain school boards that are not allowed to have any THC in their system. So this is a picture that depicts and explains the cannabis sativa, the plant, the mother, and then the two species, species 1 hemp, species 2 cannabis, and then from there you have the subspecies, which are what for years have been called sativa indica hybrid, but now in reality there are more types, and they've discovered that it's not so much the sativa indica hybrid, but more the terpene component. It's the terpenes in conjunction with the phytocannabinoids that have the medicinal values and properties of cannabis. So I hope this was relatively clear in explaining the differences and how they are all cannabis, but they just have different species.
Fantastic. Thank you for that clarity and the name of your book. Can you hold that up one more time? We want to ensure.
Do you want it in English or in Spanish?
English first and then Spanish.
All right.
Hope and Healing, The Case for Cannabis by Dr. Joseph Rosado. Very good.
And then in Spanish, for those of us that speak Spanish or have family members that prefer to read in Spanish and not in English, Esperanza y Sanación, el caso del cannabis.
Awesome. Fantastic. So now we're gonna take some questions. We're gonna take questions from our attendees. You can put it right there in the chat. We're gonna take questions from the panelists. But there are a lot of questions as it relates to CBD and how it can assist with different challenges, because we know we can't say that it cures or treats or mitigates. But let's talk about lupus, Dr. Rosado. Let's talk about how CBD can assist in those who have lupus. Sir,
Absolutely.
first question.
Lupus falls under an umbrella of what are called autoimmune conditions. Autoimmune meaning that the body, the disease perceives that the body is its own enemy, and so it attacks itself. And under that umbrella, you have not only lupus, but you have rheumatoid arthritis, hypothyroidism falls under that category, diabetes type 1 falls under that category, mixed connective tissue disease falls under that category, Sjogren's falls under that category, scleroderma falls under that category. So it's a host of diseases that have been named, but they all fall under that same umbrella of autoimmune conditions. And the majority of autoimmune conditions focus on and cause a lot of inflammation. That's the biggest thing. There's inflammation throughout the body, and that inflammation attacking different parts of the body causes the different symptomatology. So if that inflammation goes into the kidney area, then they have nephritis. Itis means inflammation. So they have inflammation of the kidney or the renal structures. If you have inflammation at the level of the joints, then you have arthritis. Arthro means joint, itis means inflammation, arthritis. So rheumatoid arthritis. You can get lupus as well. Lupus also reflects itself in the skin. And so you get the dermatitis, you get that, the butterfly rash that's very common with lupus. So being that all of these conditions cause a severe amount of inflammation, and they also produce a lot of free radicals. Free radicals are things that cause a lot of disease and oxidation, stress oxidation in the body. CBD is not only an anti-inflammatory, but it is also an antioxidant. And by being an antioxidant and it working on the CB2 receptors, which the CB2 receptors are found in the system of immunity. So the thymus gland, bone marrow, white blood cells, the CB2 receptors are found there. CBD works on those receptors. And so now, if you can imagine a Pac-Man gobbling up these free radicals as the white blood cells go through and are gobbling up all of these free radicals that cause this dis-ease or lack of ease. So by utilizing CBD in conjunction with the conventional treatments, it's supporting your immune system to build the immunity to be able to ward off these free radicals, but also supports the body in its ability to reduce inflammation because of its anti-inflammatory effect.
Awesome. Does multiple sclerosis fall under an autoimmune disease?
Yes, ma'am, it does. That affects primarily the nervous system. And so one of the benefits of CBD is that it is neuroregenerative. Neuro means nerve. Regenerative means that it regenerates the nerve. So it supports individuals that have the multiple sclerosis, because MS, multiple sclerosis, is what's called a demyelinating condition. Myelin, if you picture this finger is a nerve, okay? And so I wrap this piece of paper like a sheet around my finger. This piece of paper represents the myelin, okay? Because it's an autoimmune condition, the body will attack this myelin sheath and it rips it off. And now this nerve is raw, it's crude, it has no protection, no covering, causing severe muscle spasms and pain. And so by incorporating CBD in conjunction with conventional treatments, of course, it aids in the neuroregenerative process of the nerve, but at the same time, it helps with the muscle spasms and it helps with the pain associated with the inflammation caused by that nerve being so raw and so aggressively stimulated by everything.
Fantastic. I'm not sure why my attendees are so quiet tonight, but I'm going to ask another question because I
I'm
don't.
going to be confusing the hell out of them.
No, they said it's very clear. They say you're so clear. Oh, and they just ordered your book. So,
Oh, thank you.
This is Dr. Tyus. I have a couple questions, but I'll start off with one, so I don't want to hog the stage here. But I've looked under, small studies regarding how the CBD helps with blood pressure. What is your experience with? Does it help the blood pressure lowering? No effect? What is your experience?
Did you watch my show, my podcast this past Friday in Spanish?
No.
With Cana Latinos? I think you were. I think you were watching.
No.
Or were you in Orlando in February when I gave my talk on cardiovascular system and blood pressure and CBD?
I missed that. Sorry. Lo
All right.
siento.
All right. Oh, very nice. All right. So excellent question. And with hypertension, with high blood pressure, an actual study was done with people that had no blood pressure issues whatsoever. Okay, they had no hypertension. They did not have that diagnosis, and they were given 600 milligrams of CBD. And shortly after being given the 600 milligrams of CBD, it lowered their blood pressure because of the what? Anti-inflammatory effect, but it also has a vasodilatory effect. It vasodilates the blood vessels because it works at the level of the endothelium. Endo meaning within, thelium is tissue. So within the blood vessel, it works on that tissue level and it causes an opening or vasodilating, it opens it up and it allows for the blood pressure to drop. And so it did drop the blood pressure. And so a product has been created in Canada and it's going through right now phase 3 testing where it's a CBD product that they are using for cardiomyopathy. So there is a strong link. Also, what causes, when there's a blockage or an obstruction in one of the arteries, the blood doesn't get through. Imagine, if you will, a garden hose, okay? And if you have this garden hose and you step on that garden hose, the water's not gonna get through, okay? So imagine that foot that's on the garden hose, a blood clot or a clot in that artery is not allowing the blood to get through. Blood carries oxygen to the tissue. By not having any oxygen getting to the tissues, it causes ischemia, tissue death. That causes stress oxidation. It increases the oxidative stresses in the body. And so it begins to cause tissue damage, tissue death. By incorporating the phytocannabinoids, and they have found that there are CB1 and CB2 receptors in the cardiomyocytes, in the cardio, heart, myo, muscle site cells. So in the heart muscle cells, there are cannabinoid receptors on those cells. And so the CBD is able to work on those cells to help with ischemia, but also help to give nourishment to the muscles.
Fantastic.
Excellent. Excellent. Thank you.
Yes, but you might want to.
Hi, this
The
is
podcast
Dr.
is in Spanish only, not in English. I just saw a question.
Hi, this is Dr. Glass in Detroit. I'm also a DC out of Atlanta, like you, back in 1983.
Oh,
Yeah.
you're old school.
I know. I really appreciate the clarification of CBD versus marijuana, and also what I can use now, because in my practice, I treat a lot of MS patients, and the clarification that a lot of the patients just want to smoke cannabis, want to smoke marijuana all the time. And you making it very clear and then giving some clarification on male and female. I just want to applaud you for a very concise and detailed explanation. And thank you very much.
My pleasure.
Dr. Rosado.
Yes.
Hi, my name is LaShawn Garola. I'm a nurse on the panel here, and I also have lupus, as Dr. Rita mentioned. I was diagnosed in 2010, so 10 years ago. And I started using Wakana CBD products in November of 2019. So what is that, about 8 months or so? Every year since my diagnosis, from 2010 up until February of 2019, I was hospitalized at least 1 to 2 times a year for major flare-ups that affected my lungs, lupus pneumonitis.
Mm-hmm.
Since I've been doing the CBD,
inflammation in your lungs.
yes,
Yeah.
yes, yes, itis, inflammation of the lung, around the lining of the lung. Well, earlier you mentioned how the CBD can be used as an adjunct to the traditional treatments for lupus. So my base medication would be mycophenolate and Plaquenil.
Mm-hmm.
And since I started using the CBD, I've had to use less prednisone to get me through over the humps of severe flare-ups. I mean, I still have flare-ups, but I've not been in the hospital overnight since.
You know why?
Well, I would imagine that the CBD has a lot to do with that.
CBD
Now, right
is
now
quite-
in Chicago, it is 90. It was 95 today. As you know, heat can trigger lupus flares.
Mhm.
For me, extreme cold, like our winters, can also flare me. My question is this: in working with my care team, so I have a PCP, I have a rheumatologist, I have a pulmonologist. Really, just trying to get everybody on board with how I want to have my care go as it relates to CBD. Now, I use it obviously, but you know, medication reconciliation, you go to your appointments, they, you know, ask, you know, what you taking, anything new, any over the counters, any this, any that. And so what I'm finding is a lot of physicians really just don't know about CBD.
Nope, they don't.
Yeah.
You're right. Now, the reason why you're using less prednisone is because CBD is twice as strong as prednisone as an anti-inflammatory, and 20 times as strong as aspirin as an anti-inflammatory. So that's why you need less prednisone, which is to your advantage, because prednisone can lead to idiopathic Cushing's disease
Yes.
or Cushing syndrome, which you get the moon face, the buffalo hump, and it can also cause diabetes.
Mm-hmm. Well, I'm still finding that there is, you know, because there's a lack of information or knowledge about it with the providers, even more so in my role as like a discharge coordinator. I noticed that when patients are honest and say that they use cannabis or marijuana, that really upon discharge, the first thing that everybody wants to do is refer them to addiction medicine. And it's just ironic because they don't really assess and ask, why are you using this? Is this for anxiety? Is this for depression? Is this for pain? They just automatically, and usually it's brown people or Latino people or patients that they just have this negative association still with the use of marijuana to control pain and symptoms.
So my best recommendation is, one, recommend my book, because the book was written for everybody. There is some medical jargon in there, but it's referenced. So if people want to read more, they can go to those references. But it is very easy to understand and very easy to comprehend. You can direct them to my book. You can purchase the book and give it to them as a gift and educate them. You can also direct them to my website, which is josephrosadomd.com. josephrosadomd.com. And in there, they can on that website, aside from the information that's on there, they can also have access to the book and purchase the book online.
Thank you.
Yes, ma'am.
Thank you so much. Dr. Rosado, the
Yes, ma'am.
attendees are waking up with questions now.
All right, let's go.
Let's go. So, about how long does it take for the CBD to nourish the tissue?
It depends the mode of administration, depends how you take it. If it's, now you guys don't have any inhalation products, to
We
my
do.
knowledge.
We have our vape cartridges. We do have pre-rolls.
Okay,
We have
so
the
then,
fast-acting products. Yes.
okay, fantastic. So when you use an inhalation process, you get the effect within 3 to 10 minutes. Now understand that CBD, and here's another misnomer, and something that we need to clear up.
Okay.
People say that CBD is not psychoactive, that THC is psychoactive, but CBD is not. That is a lie. They are both psychoactive because you have CB1 and CB2 receptors in your brain. Psychoactive means that it's working on your brain. So CBD and THC are both psychoactive, just like coffee is psychoactive, just like hot chocolate is psychoactive. You have receptors in your brain. Okay. What the difference is whether it causes euphoria or not. That's the key term. So CBD does not cause euphoria. THC does cause euphoria, as does CBN. CBN also causes euphoria. So that's the proper term. So they both are psychoactive because they both work on the brain. Now, the challenge with CBD is because it doesn't cause euphoria, a lot of people don't like to use CBD because they say, I use it and I don't feel anything. And the important thing that they understand is that they're not going to feel high because
Right.
it's working at the cellular level, okay? Because we produce endocannabinoids, we produce cannabis in our system. Now, there's an enzyme in our bodies that destroys the cannabinoid that we produce. We produce anandamide, 2-AG, and 3 others that have been named. There's an enzyme called FAAH, fatty acid amide hydrolase, also known as FAAH, FAAH. FAAH deactivates or cuts the lifespan of the anandamide. Now, CBD blocks the action of the FAAH. So that's why everyone should be on CBD, because by everyone being on CBD, it blocks that enzyme from attacking the endocannabinoids, and it allows for the endocannabinoids to express themselves. So that's why everyone must be on CBD to be able to offset the action of that enzyme that is attacking the endocannabinoids. So when you use vaping, you get the effect within 3 to 10 minutes. When you do sublingual, it takes 90 minutes for you to get the effect. When you take an edible, whether it's a capsule or something edible that you eat, it takes up to 2 hours to get the effect into your body. So for that reason, I encourage all my patients to mix the modes of administration. Do the vaping in conjunction with a sublingual, in conjunction with an edible, because as one is wearing off, the other one is kicking in. As the other one is wearing off, the other one's kicking in, because the vape lasts 2 to 4 hours. The sublingual oil lasts 4 to 6 hours, and then the edible can last as much as 8 to 12 hours, depending on how you metabolize. So you want to use all of the modes of administration to be able to attack all of the different levels. So, and again, it depends on the level of disease that the person has that will determine how quickly you will be able to reverse the hypoxia or the ischemia or the neurodegeneration, like in case of people with Alzheimer's or Parkinson's or Huntington's or MS.
Awesome. And that's exactly what we always talk about every week, Dr. Rosado, is combining all forms of consuming our CBD products. So you have that constant CBD and the endocannabinoid system being fed on a constant level. So very good. Another question. It's shown that one of the endocannabinoid receptors is in our teeth. How does CBD deal with inflamed gums or ease the pain system usually generated by a tooth abscess?
Okay, again, as we mentioned earlier, because of its anti-inflammatory effect, when you put the sublingual drops under your tongue and you let it sit in under your tongue for, the 45 to 60 seconds, but also you have a product that's a combination of multiple oils that you recommend putting it on the toothbrush.
Yes,
And because
that's very essential defense. Yes.
right, because again, it's a combination, it's a multifactorial situation. So, as great as CBD is, it's important to incorporate as many things as possible. So that product of yours that you recommend to put it on the toothbrush, again, that is going to support the oral cavity, but as well as putting the drops under the tongue and letting it sit there. And then before swallowing it, swishing it around in your mouth for a minute will help bathe that whole oral mucosa and before it goes down into your gut.
What about CBD and asthma?
I have asthma. I have COPD. There are there are cannabinoid receptors in your lungs. So by using it in an inhalation form, and I inhale, I have an actual meter dose inhaler that's CBD. And I do that in conjunction with my other inhalers. I use Pro Air for breakthrough. I use Atrovent, and I use that because it helps reduce the inflammation in my lungs. So absolutely, there are cannabinoid receptors in the lungs.
Dr. Rosado, have you ever worked with a patient with NF? Can CBD help shrink the tumors?
NF, neurofibromatosis?
Yes, neurofibromatosis.
Yes, I have a mother and a son that have von Recklinghausen's neurofibromatosis. And I think I sent you the testimonial of the little boy, of the son, of the male patient. He's a college student. He's in his early 20s. And because of the tumors, he has severe scoliosis because the tumors have caused a deviation in his spine. And it has caused a shrinkage of the tumors. It has managed his pain. He's back in college. He's working. He's a photographer now. He took photography classes and he's working as a photographer, which he's carrying equipment around and taking pictures, and he's doing amazingly well. And yes, the mom and son. In fact, I see mom tomorrow.
Fantastic.
Yes.
Does CBD help with gastroparesis?
Although there are cannabinoid receptors in the gastrointestinal tract, it's mostly CB1 receptors that are found in the GI tract. So patients with gastroparesis, on those patients, I tend to go more the medical cannabis route than the CBD route. Although the CBD helps with the inflammation, as far as working on the CB1 receptors, there's a need for a little bit more than 0.3% THC to help manage those patients. I've got quite a few patients. In fact, I started one today that has gastroparesis. And the only thing that helps is the medical cannabis. On those patients, it's a 1-to-1 that I recommend. It's a one part CBD to 1 part THC in a capsule form, 25 milligrams of each. And they take it orally at bedtime because as it's going through the GI tract while they're sleeping, it's working on the receptors and they wake up feeling better and refreshed.
Perfect. Please explain how CBD helps with the bone-on-bone knee pain. Is there any information about CBD regrowing cartilage?
Not so much cartilage. It has been shown to grow bone.
Right.
There have been studies showing that it will replenish, it works on the bone cells and it will restore bone. As far as cartilage, not so much. For cartilage, it does help with the inflammation because of the inflammatory process. But for that, you want to use more of like an MSM, chondroitin, hyaluronic acids, and take that in conjunction because that tends to prevent the deterioration of the cartilage and can replenish the cartilage.
One of my daughters was diagnosed with a lung disease. I don't know the name, stemmed from continuous exposure to black mold. How can she engage the use of CBD to help her?
How old? If she knows how to inhale, and if she's not Bill Clinton and knows how to inhale, then an inhalation would be fantastic.
Deborah
45 years old,
Blackman,
so I think she knows how to inhale.
yes. Deborah Blackman, how old is your daughter? If you could put that in the chat.
She did, 45.
Oh, look at you. How did you see that? Oh, there it is. 45.
I got bifocals, that's why.
That's why I need my glasses.
You should put your bifocals on instead of being all.
Okay, so does CBD help with with the spine, C4 through 5, L6 through 7, which is cause loss of strength in fingers.
Okay, it sounds like they may have some type of radiculopathy, either herniated discs that are putting pressure on the nerves as they come out. And the CBD will help with the inflammation. The classic treatment for herniated discs are anti-inflammatories. They start with non-steroidal anti-inflammatories like ibuprofen. And then if that doesn't work, then they transition to steroids and they give them a steroid, prednisone or Medrol dose pack. And if that doesn't work, then they go the epidural steroid injection route. So it's all about giving them steroids and injecting steroids into the area. Steroids are an anti-inflammatory. So by using the cannabis, it will help with the inflammation, but also in a topical form, it works really well. Especially having been a former chiropractor, there was a technique, or one of the techniques that we learned as part of the life package was life upper cervical. And I don't know about your time, but Dr. Grostic was there at my time, and they were big into the orthospinology, which is upper cervical work. They only adjusted the first and second vertebrae in the spine because they felt that if they adjusted the upper cervical, it worked everything, because all nerve transmission has to go through this area. So one of the places I tell patients to apply their topical creams is in the upper cervical, upper neck area, especially at bedtime, especially if they are migraine sufferers. Applying the topical cream in the nape, what we call in the street, on the nape of the neck or the back of the neck, covering the whole neck area from here to here. All transmission from the body has to go there, but all transmission from the brain down also has to go there. You have tracts that go up and tracts that come down. And by putting the topical cream in that area, it's absorbed and it'll penetrate and work directly on that location.
Wonderful. Topical CBD. We have some of the best here, Dr. Rosado. Prostate cancer. I need to know about prostate cancer and CBD, please.
Okay. All cancers, CBD has a function that's called apoptosis.
Yep.
Apoptosis is a big medical word that means tumor shrinking. It shrinks tumors. And not only does CBD have that, but many of the other phytocannabinoids have that as well. My father-in-law, 4 years ago, 4 years ago, 5 years ago, in 2015, was diagnosed with prostate cancer. And I had, that weekend, I was at an event, and it was the first time I met Montel Williams. And in speaking with Montel, he's got multiple sclerosis. We were discussing his condition, etc. And we were talking about different things, etc. And it was a bunch of doctors there, as well as lay people. And there was an individual that was selling a highly concentrated CBD. It was like sap. It was so thick. And it was like 0.1 milliliter, which was like one black line on a syringe. It was like the tiniest amount, had like an incredible amount of CBD. And I bought 4 of those syringes and I sent them to my father-in-law. And he started using that as I told him to use it, and he's still with us.
Wow. What a blessing. What a blessing.
Now he did, he did do the radiation therapy. He didn't do chemo, they did the radiation therapy. So he did get the radiation treatments, but in conjunction with the radiation treatments, we incorporated that CBD, and it worked amazingly well. And then last year, He lives in Puerto Rico. Last year, they finally got money from FEMA for Hurricane Maria, and the roof of his house had been ripped off. And so he finally got some money, so they were repairing the roof. He was up there, and he's in his 70s. He was up on the roof working, looking at what the workers were doing, and he's got some ladder, a ladder that goes down, but the ladder didn't have a banister, so he didn't have anything to grab onto. He slipped, fell, landed on his right side, fractured multiple ribs on his right side.
Have mercy.
Ended up with a hemopneumothorax, blood and air in his lung, collapsed his lung, just destroyed. And again, we got him some topical CBD with CBG. It was a 1-to-1 CBD with CBG and high doses of CBD with some vitamin D, some calcium to help with his bone, but the CBD with the vitamin D, with the calcium, and the topical CBD with the CBG, within 4 months, he was back at work, and he's a salesperson at an appliance store. So,
Wow.
and a month, like right after he got out of the hospital, a month afterwards, he went to see the surgeon for their follow-up chest x-ray. When they did the chest x-ray, they saw that the bones were like reattaching and aligning properly and healing, and he had no inflammation, and he was walking, and the surgeon was like, "What are you doing?" And he said, "Well, my son-in-law sent me this from the United States." And he's like, "I don't know what the hell that is, but keep doing it."
Yeah, many of our colleagues say that, right? They don't want to hear about it. They just say, keep doing it, keep doing it. Last question. How does CBD assist a person with congestive heart failure?
Ooh, with congestive heart failure, that's a challenging condition to manage because there's so many systems going on. Typically, when there's CHF, there's also issues going on with their kidneys. Their kidneys, they're usually in some type of renal failure, or they've got some type of chronic kidney disease in conjunction with other stuff. So they're on multiple medications. They're on a diuretic, they're on a beta blocker, they're on a calcium channel blocker, different things to address different issues. Now, the fact that there is a lot of stress oxidation going on and a lot of issues happening because of the heart failure, it's very important that they do incorporate and utilize the CBD together with all of these other medications that they're on, but and as well as monitoring their diet, maintaining a low salt diet, exercising. There's a lot of factors, and those are very, very challenging cases to manage. Obviously manageable, but those respond a little bit slower than some of the other ones that I've mentioned earlier.
Got it. I know we're after 9 o'clock, but can we talk about glaucoma? And
CBD, unfortunately, the studies do not show that CBD reduces intraocular pressure. THC is the one that reduces intraocular pressure. So it's more the THC that works on glaucoma, not so much the CBD.
Okay, well, let's talk about that some more because I found some data that it's low levels of CBD that you have to use to decrease the intraocular pressure. In fact, the study I found was that you can't use any more than 40 milligrams per day of CBD to reduce that pressure, reduce the inflammation around the optic nerve. So we'll talk about that some more.
That's a great topic. And that's enough. I'm glad you brought that up because there's the latest school of thought is that you want to microdose and not macrodose.
Right.
So the latest research is pointing to using lower dosages rather than higher dosages. However, there are situations and circumstances where you do need the higher doses. For example, cancers. Every one of my cancer patients is on no less than 500 milligrams of CBD per day. That's just the way it is. They are on that amount of, because
Yeah.
You are dealing with a really terminal condition, and we need to be very aggressive. So definitely. I just saw a question about dementia. Yes, I did a talk in Colombia pre-COVID-19 last year in November of 2019, and my topic was on Alzheimer's and dementia. And we've got a study going on. We were in the process of, we got approved to do a clinical trial. There's a specific region just outside of a city called Medellin. There's a population that has a higher incidence of Alzheimer's in that community. And in the United States, Alzheimer's is the 6th leading cause of death. In Colombia and in Puerto Rico, it's the 4th leading cause of death.
Wow.
And so we had this study going on to study the use of CBD on these patients with dementia, with Alzheimer's. And in Puerto Rico, there's a medication called Hyalalex, 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 yeah. And it's cannabis with turmeric and melatonin. It's a combination of those three, because the cannabis, the CBD, helps with the inflammation at the level of the brain, so it helps reduce the inflammation. But studies have also shown that it blocks the formation of the plaques, the amyloid plaques that are formed, and the tau proteins. It blocks the function of the tau proteins, which prevents the formation of the amyloid plaques. So it blocks progression, but sometimes shows regression because of the neuroregenerative processes in the brain, in conjunction with turmeric, which is an anti-inflammatory, and then the melatonin, because it helps with the circadian rhythms, because that's another problem with patients with Alzheimer's, that they sleep during the day and they're up all night because they're disoriented. So by giving them that at bedtime, it helps them sleep, but it helps with their brain. Amazingly well. And in fact, I put my grandmother-in-law on that medication in Puerto Rico, because I'm licensed to practice there. And I put her on that medication, and she was, her and my mother-in-law had just done laundry, and they were folding the laundry. And the grandmother came in and said, well, what are you doing? She said, I'm folding the laundry. You want to help? And she's like, yeah. And she grabbed the socks and was able to match the socks, which for someone that has Alzheimer's, it's like, what? She was able to match the socks and match them correctly. You know, for us, it's like, what's the big deal? She matched socks. But yeah, it's amazing. And I saw another one about CBD and epilepsy. Absolutely. There's a website, there's a page. In fact, a lot of the stuff I learned regarding CBD was on this page called CBD for Children with Epilepsy. And that's where I learned the struggle that parents go through, going to neurologists, going to their pediatricians, not having physicians that understand the endocannabinoid system or cannabinoids, and telling them, no, that's a bunch of crap. But here, let me stick another medication on your kid.
Exactly.
And these kids are on like 5 anti-epileptic drugs. They're zombies. They're still having seizures. And oh yeah, let's give them this. So in my book, I speak on that, and I reference Charlotte's Web, which, you know, she was on CNN. Sanjay, that's what made Sanjay Gupta a believer in CBD, was seeing her story. And I have quite a few patients that have her condition. She had Dravet syndrome, and I have quite a few patients that are on that. And the FDA got wind of it, and they made Epidiolex, which is the first FDA-approved medication that comes from CBD, from the plant, not synthetic, not made in the lab. It comes from the actual plant. And now here's the hypocrisy of this effing country. And then the Bronx in me had to come out. I'm sorry.
Uh-oh, the Bronx is coming out.
Here's the hypocrisy. Cannabis from the plant is a Schedule I drug, where they say that it has no medicinal value and a high level of addiction. Synthetic cannabis, also known as Marinol, made in a lab, doesn't come from a plant, is a Schedule 3. That means I don't have to write a prescription. I can call the pharmacy, or my medical assistant can call the pharmacy, call the prescription in, and it's filled. It's a Schedule 3 drug. Epidiolex that comes from the plant, that's CBD isolate, it's not even whole, it's not full spectrum, it's a CBD isolate, is a Schedule 5. Schedule 5 means low level of
Like a
dependence.
cough drop.
Exactly. It's a freaking cough drop. And now they're going to take it off the schedule and start selling it over the counter. And what do parents have to pay for that? $32,000 a year. It's 32,000 MFing dollars a year. That's a salary. My mother was a teacher's aide. My mother never made $32,000 in her freaking career.
That's the FDA for you. God bless them.
And I've had children come into the office that all three, mom will come in with 3 kids, and all 3 kids have Dravet's. They have the genetic component. Now imagine if every one of those kids, mom had to drop, that's $100,000 a year for medication for a plant. Are you kidding me?
God bless
Ooh,
you.
I got hot.
Huh. Dr. Rosado,
Dr. Rita, you got me wound up. You got me
wound up. Can you drop your email in the chat for us? So
Sure.
we can
Yeah, my email at my website is josephrosadomd.com. And my email address is info@josephrosadomd.com.
perfect timing. Our patient is 9 centimeters. Is this perfect timing? I'm like, push, don't push. But thank you so much. This has been incredible. Would you not say, put it in the chat? Let's thank Dr. Rosado. What an amazing, informative, engaging conversation.
I put my email address on there. Any questions that you have, go to my website. If you have any questions, and I'm sure Dr. Glass will appreciate this. This is from my old chiropractic days. I offer a 15-minute free consultation. All right. So you go to my website. There's a section that reads book. You click on that, and there's a calendar. You can schedule a free 15-minute consultation with me. Any questions that you have for those 15 minutes. After that, I am going to charge you because I am a student of Sid Williams. So.
Oh, well, I'm excited. Dr. Rosado and I have some very, very exciting things we're going to be doing with Wakana as
Someone hit me up. Am I interested in a business opportunity?
Yes.
Are you kidding me? Look at that.
He's already my distributor. Leave him alone.
Holy crap. They don't respect that. That is a hell of a business person right there.
That's right.
That is a business person.
That's
No
a business
fear.
person.
Boom.
Well, thank you so much, Dr. Rosado. We thank everybody that joined the line.
Thank you for the invitation. Thank you to the medical panelists. I appreciate all the questions.
And we'll see you very soon.